I am very excited to introduce our next speaker, Lucy Pérez. She's a senior partner at McKinsey Company's Boston office, advising CEOs and teams at leading companies globally on growth strategy, innovation, sustainability, and organizational transformation. Lucy is particularly passionate about advancements in science and technology, which are transforming patient care delivery and outcomes. A former cancer researcher at Memorial Sloan Kettering, she brings a strong technical background to her work with organizations across the healthcare sector. Lucy co-leads McKinsey's global client service in sustainability and social impact strategy and has spearheaded efforts to convene a community of leading sustainability executives across the greater Boston region. She is responsible for McKinsey's North America diversity, equity, and inclusion efforts, and as a leader in McKinsey's life sciences practice, Lucy leads McKinsey's efforts on health equity and women's health. Beyond her work at McKinsey, Lucy is a board member of the Massachusetts Business Roundtable and sits on the advisory board for the Aspen Institute's Latinos in Society program and the Women's Health Innovation Summit. Lucy was elected one of Amplify Latinx's inaugural Latinx 100 Leaders in Massachusetts this year and named an Aspira Circle of Achievers 2023 award recipient. Lucy is an avid traveler, amateur photographer, and a co-inventor on multiple patents. With her expertise in healthcare and a focus on improving women's healthcare, Lucy is poised to enlighten us on how advancements in this field can unlock trillions in economic potential. Let's warmly welcome Lucy Perez, Senior Partner at McKinsey & Company's Life Sciences Division, you can clap, for Talk 3, Improving Women's Healthcare Could Unlock Trillions.
Hi, everyone. Buenas tardes. It's such a pleasure to be here today, and thank you, Anita, and the whole Amplify Latinx team for having me here to have a conversation about women's health, a topic that maybe surprises you for having it on the agenda, but the reality is there's such a strong connection between economic growth and health. If we take a look back at the last 2 centuries, right, and we look at the economic growth that has happened, the biggest driver of that growth has been improvements in human health. The reality, though, is that when you look at those improvements in human health, the big gap that really stands out is how women have been left behind. And so what I would love to do with you all for the next 15 minutes or so is talk about how can we all collectively take action to correct a lot of the misconceptions that exist around women's health, and what is the opportunity that comes associated with it if we get this right. In talking about this, I'm going to be referring to a very large piece of work that involved a lot of folks, both at McKinsey within our Health Institute, as well as a collaboration with the World Economic Forum and a coalition of more than 40 organizations and individuals around the globe that really wanted to understand what is the economic impact of investing in women's health. We had a sense that it could be a large number, right? We're talking, after all, about half of the world's population, and a recognition that we needed to have a better way of articulating the criticality of why this is something that is critical to get right, not only because it's the right thing to do, but also because, again, there's a lot of benefits that could be had more broadly. And so as I go through this presentation, a caveat, I will be talking about women's health and referring specifically to cisgender women, for which we had the data with which to do these types of analysis and really understand what was going on. It highlights how massive the data gaps are when we try to understand the realities, for example, for the transgender, non-binary communities, and a real recognition that we need to do better in terms of how we collect the data and how we answer the questions that ultimately will help ensure that we get to better health outcomes for everyone. There was a lot of data that we mined to take a look and understand what is the implication, right, of investing in women's health. I am going to point you to these numbers because I'll come back to them later, and I hope they, one, help to inspire confidence around the opportunity that we have here, but also the realization of how critical it is that we all collectively take action. We wanted to focus on a subset of conditions, right, diseases that, when you look at them together, account for the majority of the women's health burden. So we focus on the 64 conditions that you see on the slide that collectively represent 86% of the health burden that the average woman carries. To do this, right, we looked at the literature, and so this involves more than 650 academic papers that reflect what is the standard of care, right? How are people today being treated? What are the expected outcomes? Because we wanted to then go through that data to understand, what do we know about sex-based differences? What do we understand about how men and women may respond differently to a treatment, how a condition may manifest differently? And I want to anchor you on those numbers just so that you understand like the confidence that we have then. It's not only the data that we leverage, but back to the prior slide, how many people work together to get at these analyses. And the reason why I keep emphasizing that is because there are so many myths. And so that's what we're going to dive into. What are the myths that surround women's health? The first one, probably many of you know that women on average live longer than men. I assume this is not a surprise to most folks. So what may surprise is that whenever I bring up the topic of how passionate I am about women's health, people are like, a natural response is, why? Women live longer, right? Actually, women are healthier than men is usually the interpretation that is made, right? Because there's almost this implicit assumption, if you live longer, you must be healthier. Well, I will ask you, is that true? This is what the data shows. It is indeed true that women live longer than men. But when you ask the question, years lived in good health, women are actually spending less time in good health than men are. Told in other ways, women spend more time in poor health than men do. Actually, 25% more time than men do. And so this is really important because it really highlights the criticality of thinking, are we using age as the ultimate health metric? Or should we be thinking about number of years lived in good health as the critical metric that we want to optimize, right? And think about that being that end outcome. This 25% number that you see on the chart is a global average. Countries span from some of the best performing countries where there is still a health gap is about 12% of time spent, additional time spent in poor health for women, to the worst performing countries that are about 40% more time spent in poor health by women. So data point number one, what typically is the response when you share this data? Of course women spend more time in poor health. They live longer. So that's when all that poor health happens, right? It must be happening at the end of life because they live so much longer. So let's take a look and see, is that poor health, that disparity that we see in health outcomes, concentrated at the end of life? No, it's not. It is actually, the majority of it is happening during women's prime working years. We're talking about this health gap really manifesting during ages 20 to 60 for women. This is, again, something that before this research, it wasn't very clear to many folks. And why does when it happened matter so much? It matters because then it has even greater economic implications. Because we're talking about taking women out of the workforce more frequently, right? During those years, it has the implication not only to their own health outcomes, their ability to make choices around how they spend their time, but it has implications for their communities, their employers, right? And so that is why when this health gap happens, that it matters so much. Okay, so then people are beginning to get a sense of, there may be something here that we want to figure out how to improve. But then what's the next question? Well, what is women's health? And so for a long time, we've thought of women's health as frankly shorthand for sexual and reproductive health. But the reality is the majority of the burden of disease that a woman carries, it's actually associated with conditions that impact women differently or disproportionately. Too often we want to do the shortcut and say women's health refers only to conditions that are unique to women and that we catalog around sexual and reproductive health. As you can see from this chart, that is only 5% of the disease burden that a woman carries. When you take a look at those conditions that impact women differently or disproportionately, again, we're talking about much more than the half. And this is the part that is surprising to many folks. Let's talk about what we mean by these, right? Conditions that impact women differently. Cardiovascular disease is an example. Many of you may be familiar with what are the typical symptoms of a heart attack, right? Where there's like pressure on the left side of your body, you're holding your left arm. And indeed, that is the usual manifestation of a heart attack in men. In women, that is not always the case. In women, oftentimes it is confused for maybe the woman has indigestion. And that is one of the reasons why women tend to die from heart attacks at twice the rate of men. And I'm talking about data that is happening in our country, in our backyard, right? The majority of medical schools, even here in the United States, when they're teaching, they are not focusing on how some of these conditions may manifest differently between men and women. So it's not surprising that, a woman may show up to the ER, and because how the symptoms of disease manifest does not match the way that provider has been trained, that provider misses those symptoms, sends the woman home, and unfortunately, too many times, we encounter the worst health outcome, death. Let's take a look at conditions that impact women disproportionately. That's a big part of this burden of disease. Some of these are immunological conditions like rheumatoid arthritis, lupus, and for a long time, we thought, women have 2 X chromosomes. That second X chromosome, of course, must be silent, doesn't have a role to play. We're beginning to see that actually there's a very critical role there, and we need to understand why is this disproportionate outcome. Some of these conditions, their prevalence is such that 80% of the patients are women. But yet in the way that science has been pursued, we haven't asked why. And in understanding the why, we will become closer to finding an answer for thinking about then how do we cure. And then the last part of this chart, and I'll keep us moving, the 43%. These are the conditions for which we don't have evidence to date about there being differences between men and women. But I anchor on the to date, because too often we have not asked the question, and I'll get into some more detail around that. But before we do that, let's quickly talk about the last myth that we will touch on today. And it is this idea that too often women's health is perceived as a niche opportunity, something where, frankly, there may not be that much money to be made, okay? Again, I take you back, half the world's population, but many of you may be aware of the condition called diabetes. There's a lot of products, different solutions. Do we have a cure yet? We don't, but there's a lot of different solutions in the marketplace, therapeutics, right now. And in addition to that, there's a very robust pipeline. More than 500 assets are in clinical development right now for a condition that impacts 1 in 10 adults on average. I'm going to talk to you about endometriosis as one example of the opportunity for women's health. Endometriosis is a condition that, for those of you who may not be familiar with it, impacts 1 in 10 women. Pretty much the same prevalence as diabetes, right? It is extremely painful and can keep that woman or that adolescent from high school, going to class, from going to work, and we unfortunately do not have a good solution. On average, it takes 10 years to get diagnosed, because so often those women suffering from endometriosis are told, oh, pain is normal. You're just having bad period pain, right? Their pain is literally being dismissed. You look at the pipeline, we're talking about on the order of like 20 assets in development for a condition that impacts, again, 1 in 10 women. So of course, if you basically run the math and say with a market of that size, if we had a solution that actually addressed the needs of those women, you could be talking about a market opportunity that could be superior to some that we all know are humongous, right? Like diabetes, cardiovascular disease, immunology. A reminder that if we invest in this space, there are very real market opportunities to be had, to say nothing of the overall economic opportunity of having more women in good health. So the question you'll naturally ask, what is driving this? I mean, again, half the world's population, how do we find ourselves in this situation? And the reality is that we started from having a very limited understanding of those sex-based differences. Indeed, are there differences between men and women? I'm going to take you back to the first slide where I made a point about those 650 plus papers that we looked at. One of the questions that we asked was, is there any data in those papers around how the outcomes may be different between men and women? Only half of the time was that question asked. Only half the time. And that half, when the question was asked, are there differences between men and women? 2/3 of the time, women had worse outcomes. 10% of the time, men had worse outcomes. Only 25% of the time did we not see differences between men and women. But yet, we operate in a world where the default is that there are no differences. But again, based on that data set, it's only 1/4 of the time. So it really highlights the criticality that we need to move away from a paradigm that talks about human biology to understanding that male biology and female biology are much more different than the reproductive organs themselves. So one big part of it. Second part of it, what's happening, sometimes we do have the knowledge. I will refer back to that heart attack example I gave you earlier. But we know that things may manifest differently between men and women, but yet care protocols in ERs, in hospitals, the training of medical students hasn't adapted yet to reflect that. So we need a greater access to sex-appropriate care so that both men and women, right, end up having a better outcome. So as I mentioned earlier, when we study those sex-based differences, we also learn, right, what are those situations where men may have a worse outcome. So that understanding of sex-based differences is key. We're missing a lot of data. You know, I will point out to you guys as one example that really shocked me. One of the biggest databases in this space to understand disease prevalence estimates that for every 100 women who menstruate, 30 make it to menopause. Clearly, we're not dying at that rate. We're not. We're just undercounted at that rate. There is a complete, at times, we're not having the right numbers around how many women are suffering from a particular condition, especially when it's a women-specific condition, and the burden of disease associated with that condition is underestimated. Why does this matter? Because that's how business cases are put together, right? We think about the number of potential customers that we may have and the value at stake associated with those customers. If the number of customers is undercounted to begin with, we don't have as robust a business case to drive further investment. And this becomes a self-fulfilling cycle and takes us to the last reason. There has been routinely an underinvestment, right, in understanding female biology and what are those sex-based differences. So why should we, let's see. I may need some help moving the slides. Or I can talk to you without slides. So what were you going to see next? Why does this matter? There's a huge economic opportunity at stake. The opportunity is over $1 trillion in addition to the global GDP if we close this health gap. And this is eminently addressable. We know where these gaps are. We know when the gap is related to gaps in care delivery or in efficiency and efficacy of the treatments that are being used. And this $1 trillion, you get to it by thinking about 4 buckets. The first one is this idea that if we close the health gap, there will be less absenteeism from women, more days that they can show up to work in full health. We all know that we oftentimes actually still show up when we're not at 100%. Imagine more days of showing up to work where you feel like you're at that 100%. Imagine as a result, similarly, third bucket, more years of healthy living, right, from closing this gap. And ultimately, the last one, women tend to do more of the unpaid care work. So when others are not in good health, they're the ones who typically stay behind to take care of them. And so when more of the world is in better health, again, another way that women have more choices, right, around how they live, what they do for work, and it has huge implications for themselves, their families, their workplaces, their communities. This is why it matters so much. And if I try to make that $1 trillion something more tangible, this translates to, for each woman, an average of 7 more days in full health every year. I think these are attractive numbers to think about They are within reach, but we need to take action. And so let me close with some ideas and why I was so excited to be here. We need more people who have awareness around this health gap that exists and actually take action, right? It is how we educate ourselves, right? To understand that when I am not feeling well, really advocating for myself. It's not just something that's in my head. These sex-based differences are real. We need to be engaging with health system and understanding are the care protocols in place that recognize those differences between men and women. Do we think about, as employers, for example, how are we supporting women's health, right? What are the benefits that we have in place to support women over their life cycle? And how this may need to be different, right, than those for men, for example. Because if we take all this action together, if we raise awareness and take action, again, it is not only about better health for more women, it is a stronger economy. And so when women do better, their families, their communities, their workplaces, society as a whole does better. Thank you so much.